So Dan, could you briefly just introduce yourself and tell us a little bit about your background?
Yeah, sure, absolutely. My name is Dan Heron. I currently serve as the Vice President of Digital Health at RWS Group and the practice lead for our linguistic validation team. My background spans regulatory, clinical, and structured content authoring with a very strong focus on AI-driven solutions and digital transformation within the life sciences. Before I joined RWS, I have been in the localization industry for nearly 18 years, where I have played many key roles in building out clinical outcome assessment practice unit, developing workflows, driving strategic initiative. And over the years, I've led global expansion efforts, partnering with key partners and worked on streamlining linguistic validation, regulatory and clinical processes through the use of technology. I'm very passionate about innovation within the digital health, regulatory solutions, and improving industry efficiencies, whether if it's through AI, automation, or better collaborations between organizations.
Wonderful. Now, health is such an important and wide-ranging topic. Perhaps you could just spend a moment telling us a little bit about the focus of your presentation and why you believe it's so relevant to our audience right now.
Yeah, absolutely. I think the three themes are create, translate, and validate. Life science organizations are facing significant challenges, really ensuring patient safety, regulatory compliance, and timely market access while managing content across multiple languages. And why it really matters is AI-driven translations and structured content solutions are really transforming how organizations handle multilingual documentation with the emphasis on reducing timelines as well as improving accuracy. So from my perspective, it's really how technology can enhance compliance and patient engagement, and really practical strategies to really streamline your multilingual content management within clinical trials.
Thank you. Now, obviously, as I say, this is a topic that could be of interest to a wide range of people, but who do you think would most benefit from this webinar and why?
Yeah, so I really think it focuses on three key pillars: sponsors, CROs, and then the clinical tech providers. But if you really want to break it down into a more relevant group, I would say clinical operations, study teams, trial managers, regulatory affairs professionals, in addition to medical writers as well as content managers. I think with these types of attendees, it really gives you a really good understanding of key stakeholders within clinical trials to really help them gain insights on how to optimize language strategies so they can improve patient engagement, regulatory submission, and trial efficiencies.
Thank you. Now, I don't want to give too much away, but perhaps you could give us a little sneak peek into some of the key takeaways from the presentation and any specific insights you hope that our audience will take away from it.
Yeah, so I think the key takeaways will be around how AI and machine translation are really changing the game, how to overcome multilingual content challenges within clinical trials, and really by implementing the right tools and processes for content efficiencies. The greatest impact attendees will see is more of a clear understanding of how to optimize multilingual communications within life sciences and a practical knowledge on how leveraging AI and automation to improve efficiencies, compliance, and time to market.
Now, it sounds super interesting. I know I'm really looking forward to taking part. But before you go, have you got any final words for our audience today?
Yeah, so before I sign off, I really wanted to personally invite each of you to join me at the event. We're going to be really jumping in a tad bit deeper into leveraging AI and automation and really exploring new perspectives that I'm certain that will really enrich the participants' knowledge as well as experience. So remember to register and secure your spot, and I look forward to meeting all of you then.
Lovely. Thank you much, Dan. I'm looking forward to it too. For our audience today, thank you very much. Look forward to seeing you on the webinar.